Good afternoon. My name is Randall Hubbard. I work here as the exercise physiologist. I'll be teaching the segment of the class today that is on exercise and tobacco cessation. Tobacco cessation is important for general health. Exercise does help with the process of tobacco cessation two main ways. One is weight gain. A common concern people have when they're stopping using tobacco products is weight gain. Exercise is one method that can combat weight gain, of course, by burning calories. The other is stress. Anyone trying to stop using tobacco products is under a good deal of stress, and exercise is one of the healthy methods to help deal with stress. Do you both feel better after you're done exercising, less stressed, more relaxed? Okay, good. Also, exercise helps make the process easier, makes tobacco use less desirable over time. The more physically fit a person becomes, the less likely they are to use tobacco products. In the United States, one of the biggest health problems we have is weight. The average person in the United States, weight has gone up tremendously in the past 20 years. In 1990, there was no state in this country that had 15% of their people obese. 2009, Colorado is the only state left. Every other state's exceeded 15%. Most are 25 to 30% obese. And that's going to play a tremendous role in our future health care cost. Our health care costs are going to go up tremendously based on diseases related to obesity. That's the humorous part of today. If you notice the fitness center and everyone on the escalator in front of the fitness center. And of course, that's not what we want to see people doing. Why is the U.S. the heaviest country in the world? One of the reasons it's thought is that we don't get much daily movement. You might have heard of a device called a pedometer. Pedometer is a device that measures steps, number of steps I take. When they compare different countries, the U.S. had the lowest number of steps and the highest rate of obesity, which makes sense. Switzerland has a much different, and Japan, diet than us, but Australia is the best country to compare. Very similar diet. They're much more active than us, and they have a much less obese rate, which makes sense. Any class I teach, a quote I often like to use: if you could pack the effects of exercise into a pill, it would be the most beneficial pill you could take. Types of exercise we'll talk about today: aerobic exercise, strength training, flexibility, and sports. And I stress that there are no bad exercises. Any exercise you do improves your health. They just do it in a little bit different ways. Aerobic exercises, examples of that include running, biking, swimming, walking, rowing, elliptical machine, stair climber. It's an activity that's continuous. The most important choice you make, though, is finding the activities you enjoy doing. If you tell me you're doing an activity right now that you don't enjoy, you're not going to want to stick with it because you hate what you're doing. So it's finding the activities you like to do, ones that don't aggravate any existing medical problems you may have or injuries you may have. Big health benefits of aerobic exercise: reduced risk for chronic disease, heart disease, cancer, certain types of cancer, diabetes. Your heart and lungs work better, your cholesterol and your blood pressure improve. And most people have improved mental health. They're less likely to suffer from anxiety and depression than people who don't exercise. But the bottom reasons, the most common reason people think about exercise is burning calories. And of course, we talked about it earlier relating to prevention of weight gain when people stop using tobacco products. If you're just starting off, 3 days a week would be fine. If you're happy with your weight and happy with your fitness, 3 days a week would be fine. If someone's long-term goal is to lose weight, they would end up exercising more. More exercise equates to more calories being burned. I would never have anyone start off with 5 days a week of exercise their first week. That wouldn't be realistic. I'd have them start with 3 days a week and gradually progress from there. Long-term goal for weight loss or diabetes would be 5 to 7 days a week, 45 to 60 minutes. If I'm out running or walking, it's not practical for me to measure my heart rate. Most people use something like the talk test. If I can sing as I'm running, I'm probably going too easy. If I can't speak, I know I'm going too hard. If you're on a machine, heart rate's easy to measure. You have elliptical machines in the facility, bikes, stair climbers, that all have heart rate sensors on them. They make it much easier to measure that. You might have seen this chart on machines before. It shows you heart rates based on age. The most important thing to notice is in the upper corner where it says estimated. Heart rates are averages. So it's assuming the average person age 40, heart rate between 117 and 169. If a person goes above the heart rate the machine shows them for their age and they feel okay, that's fine. Has that happened to either one of you? You've gone above the heart rates the machine tells you? Did you feel okay?
I did.
Yep, and that's fine because you felt okay. Because it's assuming every person that age has the same heart rate. There are some precautions. If you're on certain medications, they will impact your heart rate. The most common ones are what are called beta blockers. Beta blockers slow down heart rate, and the only person who could tell you what your heart rate would be, it would be your doctor based on a stress test. And most people don't realize it, but those are actually also classified as performance-enhancing drugs, beta blockers. And they're utilized in sports that require accuracy, marksmanship, archery, where individuals are trying to lower their heart rate so low they can fire between heartbeats. There would be no benefit of a runner taking that medication because it's slowing their heart rate down, but for something that requires more skill and accuracy, they actually are to catch people in the Olympics utilizing those medications for performance enhancement. Do either of you do strength training, free weights, weight machines? Strength training's good for your health. The way it improves your health is through your improved muscle strength and improved bone strength. Free weights, weight machines, what you have right now is resistance tubing. Resistance tubing allows you to do any exercise you'd like to do in a more portable setting where you can bring the tubing with you. Body weight's sometimes not thought of as or discounted in some exercises, but the best exercise in the world you can do require no weight except your own. Push-ups, lunges, pull-ups, squats are all great body weight exercises you can do anywhere you are. Minimal equipment needed, only pull-up bar really for the exercise we mentioned. But it's choosing what you like to do. If your goal is to add muscle mass, of course you're going to need to do some free weights. If your goal is general health and fitness, any of them apply. It's good to have a variety to choose from. There's some exercises that are better done on a machine. For example, a lat pull down. If you truly want to do a lat pull down, you have to have a machine to do it. You can work similar muscles out by doing a chin up or a pull up. Stability balls are very good for fitness too. You can do a lot of good core work on these. Some people use these at home in place of a bench. Very flex. They have these in our aerobics classes. Use these a lot. They're also downstairs in the facility if you'd like to use these for your exercise. A lot of good exercise you can do. For example, for push-ups, I can make the push-up a little more difficult by doing a push-up with my hands on the ball. And many other things you could do with this too. Good core exercises. Some people use these for core training. One example is what's called a jackknife. A jackknife would be me coming in, me coming out in a push-up position. And that's a very good core exercise. Doesn't put a lot of strain on the spine. So these, you can do a lot of unique things on the stability ball. The tubing you have today, it's just meant for different folks. Different colors are meant with different strengths. The reason we do strength training, one, is to improve muscle strength. The other is to slow down muscle mass loss. After age 30, we all begin to lose muscle mass. That's one of the reasons our metabolism goes down. The only exercise way you can stop that from happening is strength training. No matter how much a person runs, bikes, swims, ellipticals, unless they do strength training, they're going to lose muscle mass. Strength training also helps with bone density. You might have known someone who's fallen and broken a hip. Hip fractures are a very debilitating condition as people get older. Falls and fractures are usually the top reason for nursing home admissions. The stronger your leg muscles are, let's say I was working on squats. The stronger my leg muscles are, the more likely I am to prevent myself from falling. My muscles will be able to break that fall. The weaker my leg muscles are, the more likely I am to fall and then of course break my hip as I get older. Makes activities of daily living easier. Me getting up from a chair is an activity that people often don't think too much about at a younger point in their life. Getting up from a chair is a functional daily living activity. Over time, people can lose that ability, and if you've ever been to a medical supply store, they'll have a line of chairs where if you press the button, the chair will elevate you out of it because the person's lost so much strength that they can't physically get out of the chair. If you think about getting out of a chair is really doing a squat. So keeping those muscles strong make those simple daily living activities easier to do. 2 to 3 days a week, taking a day off for your muscles in between workouts. Building up to the point of muscle failure. The important words are building up. If I start my first day at the point of muscle failure, I'm going to be exceptionally sore. That's how I'd rather start off with a weight that's manageable, like in lift, that's not challenging in the beginning, but progressing up to a challenging weight as I improve with my program. Lifting slowly, generally 3 seconds to lift, 3 seconds to return is a pretty good pace. Make sure I'm not holding my breath and I'm not locking my joints as I lift. When someone's just starting a program, a common recommendation I would give to them is they start off with a weight they could lift 10 times but feel like they could lift it 5 more. Then as they progress, to keep raising that weight up so that 10th repetition is a challenge for them. And add sets as they go along. They have 2 different types of weight machines in here, live circuit machines and Nautilus machines. There's pros and cons of each. Personal preference is why one person might use one over the other. They have very similar machines on each, similar exercises for working similar muscle groups. For improving your flexibility, stretching is one method. Some people might take a class saying something like yoga. Either one will work for improving your flexibility. Flexibility is important for activities of daily living. One activity is driving. If I lose flexibility from my neck, I lose the ability to turn and look and see what's in my blind spot. And that's a common concern as people get older, as they lose flexibility in their neck, which makes it harder for them to drive because they can't turn their head enough to see what's in their blind spot. And decreases muscle soreness. If you stretch after you're done working out, it helps reduce muscle soreness in following days. If I'm doing a stretch, I should be holding my stretch. If that stretch hurts, that means I've gone too far. So I should be able to feel a stretch in my muscles. Any pain is a point which I've gone that's too far. Best time to really stretch is when you're done exercising. Do either of you play sports? Sports improve balance, coordination, agility. If you think about a sport like basketball, tennis, ultimate frisbee, racquetball, you're moving in all different directions, and that movement I'm making, and direct cutting, running, is going to help my body maintain a sense of balance. And I'm never going to fall and break my hip later in life if I have better balance. So the advantage of sports, really, they're great for improving balance. You hear a lot about people recommending talking with your medical provider prior to starting an exercise program. Reason for that is safety. Make sure if you've had a previous injury that you're not doing something that wouldn't be recommended. And that's a good step to take at the beginning of your workout. If you're wanting to know the best warm up and cool down, it's doing the same activity at a slower pace. Having good clothing and shoes. You never want to wear clothing to try to sweat the weight off. We still do see people in Florida wearing vinyl suits, which is an extreme health risk. The body can't cool itself properly. One of my favorite areas to cover are myths of exercise. No matter what you see on TV, there is no one best type of exercise for everyone. We're all different. We have different likes, dislikes. Finding the activities that works better for you. Sometimes women are hesitant about lifting weights. They're worried they'll get muscular, and it's very hard for most men to get muscular. They don't have women don't even have the testosterone levels that men do, so it makes it even much harder for them. And you have got to have really good genetics and hard training and diet to get muscular, and most people never see what they think they can see. It's just a very hard process to get very big, and especially for women. Spot reducing. We can't lose body fat from one place in our body. We can't turn fat into muscle. Fat and muscle are 2 different parts of our body. When we lose weight, our fat cells shrink in size. When they gain weight, fat cells increase in size. So it's more of a change in the size for losing and putting on body fat. Things that are missed too is you can do too much. Our bodies do need some rest involved with our exercise program to show improvement. And if something hurts, that means I've done more than I should. For using the facility, just some common etiquette rules is that if other people are waiting, you only spend 30 minutes on the machines. They have wet wipes so that individuals can wipe off the equipment after use. And if you're doing machines, it's preferred you do circuits versus multiple sets. Because what will aggravate you is you have one machine left to do, and the person in front of you is doing 8 sets. And they rest on each set on the machine, and they won't get up. And